Anaesthesiology, Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, to lead the members onto the dais. The panel members include Dr. Gurumurthy, Director, Sri Sathya Sai Institute of Higher Medical Sciences, Prashantigram, Dr. Bharat Balasubramaniam, President, Shankara Eye Hospitals, Dr. Varsha A. Shah, Honorary Consultant, CTVS, Sri Sathya Sai Heart Hospital, Rajkot and Ahmedabad, Dr. Neelam Desai, Senior Consultant, CTVS, Sri Sathya Sai Institute of Higher Medical Sciences, Prashantigram, and finally, Dr. Reeta Varyani, Head of the Department Cardiology, Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield. I request Dr. Chalam, the moderator, to take it forward.
I offer my most reverential salutation to the lotus feet of our beloved Bhagavan Sri Sathya Sai. Respected elders, esteemed trustees, organizing team, and co-delegates, loving Sairam to all of you. Thank you for inviting for this awesome conference on the world-class convention center. This particular forum will have only audio as a special status. We don't have any virtual here, except 6 of us seated here before you. Now, the preamble of Sri Sathya Sai Ideal Healthcare. We often attend the national and international conferences, and then they charge a fat fee of 10 to 20,000 rupees. They're mostly now they're come to a discussion of quality improvement and patient safety ideas. And recently I attended a conference, a medical conference, a high-level medical conference. They're telling that you must treat your patient as your own family member. We was just surprised seeing it. What is that they're telling now? Which we have been treating, following the same thing from the time Bhagavan started the General Hospital in 1954, and before that, even the medical clinics. Bhagavan advised time and again, treat the patients as your best friend, your kith and kin. And there should not be any discrimination as such. The fundamental principles as all given for Sri Sathya Sai Ideal Healthcare is a free and universal healthcare. If you enter any temple, the doors of a temple will not discriminate the feet of a rich or a poor person. It will welcome everybody equally. That's why the Sathya Sai healthcare is a free universal healthcare in the temples of Sri Sathya Sai temples of healing. And it's totally free. Here, the doctors have to plan the best possible treatment and they plan accordingly. They don't have to pay any financial considerations. And Sri Sathya Sai healthcare is comprehensive and compassionate. The very architecture of the hospitals, they are extending arms, welcoming in everybody for treatment. And if you see the aerial Google picture of Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, Bangalore, it is in the shape of K, English alphabet K, K Karuna, compassion. Everything is being given in the compassionate. And the care is rendered at body, mind, and soul at 3 levels, not simply treating the diseases. And the most important, the world has forgotten and then given less importance is preventive healthcare. The Sathya Sai healthcare emphasizes more on the preventive aspect of the healthcare. If you see the world disease burden, India is a diabetes capital, having closely 8 million diabetics. India is a cardiovascular diseases capital. It has got 273 cardiovascular mortality morbidity out of 1 lakh people, whereas the global standard is 235 mortality morbidity of cardiovasculars, for which the World Health Organization has come forward and say that you should have a healthy lifestyle and a balanced diet and physical exercise. These things our beloved Bhagavan has very simply simplified for for common person like me, hurry, worry, curry concept. If you have this hurry, worry concept, you don't have to go for any heart treatment. And other most and the last important one is timely and immediately rendered healthcare. Sri Sathya Sai healthcare is timely and immediately the healthcare is rendered whoever comes. Like suppose a patient goes, a heart patient, a heart attack patient goes, any other hospital is holding his chest in great distress and pain, then the family has to go to the billing section. If you want an imported stent or you want an Indian stent is this much, important that much, a lot of time being spent there in the negotiation at the billing counter. What happens if any patient, any heart patient comes to Sathya Sai temples of healing, straight away they will be taken into the cath labs and stent is placed in less than 30 minutes time. Here, time is heart, time is life. With these few opening words, now I have a panel of distinguished panelists. I'll ask them to deliberate on the impact of Sri Sathya Sai healthcare, the key challenge of Sri Sathya Sai healthcare, and the opportunities of Sri Sathya Sai healthcare. First of all, I'll ask Dr. Neelam Desai. Dr. Neelam Desai has been serving Sri Sathya Sai Institute of Medical Sciences and Prashanti Gram for the last 3 decades, and she has thousands of complex congenital adult operations she has performed. I wanted to ask her, please tell us what is the impact of Sri Sathya Sai healthcare and patients and their relatives. Dr. Neelam Desai.
Sairam, everybody. I think Sir has summarized. The previous speakers have summarized more or less everything. So anyway, I would like to just say that when one visualizes the number of patients who have undergone surgery in or treatment in our hospitals since inception, actually one is humbled to think that as to what would have happened to them if Sri Sathya Sai Institutes were not there. It's a fact, because the first and foremost, when illness strikes a patient, and that too, I'm talking from the heart illness point of view, he finds himself in a very difficult situation. First is from the financial aspect, and then second is the ability to get the correct advice on the treatment. As we see nowadays in the outside world, people are being operated even when there is no indication for surgery. The problem gets compounded when one is poor and he is uneducated and has no way and nowhere and no one to go to. So this is what happens to a poor man in a commercialized and material world, for which even Bhagwan in his speech has said that for the poor man, I'm building this hospital. So it is in this situation of no way out for a poor man that our hospital offers unremitting solace financially and from all angles, especially when he feels he has reached the end of the road. I actually recall, apart from this, it brings about when a person undergoes treatment in our hospital, we find a lot of these patients, they're filled with so much of gratitude. They want to give back something. So I just recall a young John, I've changed his name to preserve his anonymity. who heard of his cardiac ailment when he was in Abu Dhabi. So he came to India and he went to several institutes to get treatment, but to no avail, as he could not afford the exorbitant cost of cardiac surgery. Then he heard about our institute and he came here. He was so overwhelmed by the treatment which was which was offered to him here, that he underwent a total transformation of his heart. He joined the Sevadal organization of Sri Sathya Sai Seva organization, and he even comes now till date to offer his services. And he put, not only that, he got so much transformed that he put both his children in Swami's Educational Institute, and his son has become a teacher in one of the Swami's Institute. So he's eternally grateful to Bhagwan for the free surgery he underwent, and which he could not afford. And he says that he got a new leash of life, and this is how he would like to utilize it for others. So like this way, there are various examples which we find that the gratitude aspect, the impact which the free healthcare, our institutes are offering, it does bring about a change of heart. And I think this is what actually Swami is trying to achieve.
Thank you for sharing that heartwarming story, Dr. Neelam Desai. Now, the next question is to Dr. Reeta. Dr. Reeta is the head of the Department of Cardiology at Sri Sathya Institute of Higher Medical Sciences. Please tell us, what is the impact of Sri Sathya Sai Ideal Healthcare on patients and families?
So I think the biggest impact comes from the free treatment we offer, as ma'am has already told. So just imagine a patient who gets a heart attack or a stroke. It's an emergency situation. There is just no time to think of finances at that time. So the patient is just rushed to the hospital. He is given the best of care. He gets a primary PCI or any other thrombolysis or whatever at that point is appropriate for him or her, and then just goes out. And so the patients and their families are really, free from so many deaths, losses, and God knows what. So like ma'am said, we cannot even imagine what would have happened to them in some other hospital, standing at the billing department, having a heart attack, and somebody is trying to tell you, first you pay. So we don't have that in our hospital. I truly believe that what we are offering is all encompassing. It is incomparable. We have preventive counseling, we have diagnostics, therapeutics, we have post-counseling, and then we have outreach program, telemedicine, mobile hospitals. This is putting Swami's holistic healing right in the forefront of our healthcare mission. And human transformation, as ma'am has already told. So many patients, especially from cardiology point of view, I would say they've stopped smoking, they've stopped drinking alcohol. There's one patient who told, it's not from the fear of disease, but my non-veg eating is not aligning with Swami's principles of ahimsa, so I'm going to stop it. And there was one patient from Andaman Nicobar Islands. Imagine an ejection fraction of 15% only, severe LV dysfunction, cardiomyopathy. He came to us, we had offered him an ICD, and despite being physically challenged and financially challenged, he goes back, starts Thursday bhajans, personally contributed to the building of the Sai Mandir there, and his life is totally transformed. So there's zillions of people who have come, not knowing anything about Swami, but being touched and inspired by the mission, completely transformed their ways, and then there's no looking back. Sairam.
Thank you. So this Sri Sathya Sai Ideal Healthcare not only transforms the patients' relatives, and it's going on to the nearby community. Like self-transformation leading on to the societal transformation. This is the best example Dr. Reeta has shared. Now, I'll request Dr. Gurumurthy, the professor of plastic surgery and director of Sri Sathya Sai Institute of Higher Medical Sciences, Prashanti Gram. Please tell us, what is the impact of Sri Sathya Sai Ideal Healthcare on patients, families, and relatives?
Since 2014, I'm working in Sathya Sai Hospital. One of the best concept of this hospital is we don't bother about patients' financial status. As soon as they come, we decide about what treatment has to be given. And most of the time, we fairly give best treatment possible for the patient. In this occasion, I want to mention few of the things that happen. Say, there's one patient in 2018, a girl, 18-year-old girl came to me with a big swelling in the neck and face, involving maxilla, mandible, and neck. She had a vascular malformation, low flow type. She's from Kerala. She went from pillar to post to get surgery done. Nobody offered surgical help to her. She came to me. When I saw her, it was a big case. I assessed the patient, then told her, if you want me to operate, you have to take big risk. You may die on the table. Are you prepared to? She said, yes. Then, okay, we'll arrange surgery. I arranged for surgery. I operated the patient. When I started dissecting, it started bleeding. And somehow I could able to excise fast the whole growth. And in between, I have to face 2-time cardiac arrest in the patient, which was revived. Again, I continued surgery, excised the whole mass. Then when I see the wound, it is oozing, and it's not possible to stop any bleeding. Then immediately I called my sister, told her get benzoin, tincture benzoin. I made big pack soaked with tincture benzoin, put it into the space from here to here, and then put suture in the skin. I prayed, Swami, you have to look after Swami. Patient, I don't know, will not survive. Then after that, no bleeding happened. I put her in ICU. 4 days she was in ICU. 5th day, when I opened the wound, when I removed the pack, no more bleeding, and patient survived. After that, she had some facial palsy and other cosmetic corrections were required. I did it in another 2 stages. And in 1 year, she almost became a normal girl, and she got married, and she is working. And this is the benefit of Sathya Sai organization to the patients.
Thank you, sir. So your patient went through so many critical phases. The patient, even the heart stopped. The patient is almost near death, but came out of it. Now went back to her normal life. Now she's the breadwinner. She's employed. She's the breadwinner. That's the impact of Sri Sathya.
In this case, even today, I feel my role may be much less. Swami has played his role for the patient survival.
Yes, sir. Listening to your story, I remember the remarks or the comments, the sort of sayings of our former Prime Minister of India, Sri Atal Bihari Vajpayee. ये ऐसा अस्पताल है, यहाँ पे दवा भी है, दुआ भी है. This is such a hospital where you have the best of the best medical expertise, like a professor of plastic surgery is operating, and also he is coupled with the divine grace of Bhagavan Sri Sathya Sai Baba. Thank you, sir. Now, the first round of panel discussion we have completed. Now we'll move on to the second round of the panel discussion, that the challenges and opportunities. In the way back in 1998, that is the 50th anniversary of World Health Organization. World Health Organization, WHO, runs World Health Forum. Is a magazine, is a publication. In that publication, they have published that universal health for all, universal health for all. In that publication, our former director, Dr. A.N. Safaya, has published an article. What did he write? He wrote, what is thought impossible, namely the providing high-tech healthcare to the rural poor public in Andhra Pradesh. He also mentioned that healthcare has to be dedicated with dedication and commitment, not with any self-interest. And thirdly, he also has written that this particular healthcare model is replicable with the cardinal principles intact. So more recently, also we have seen another global sort of a recognition of Sri Sathya Sai Healthcare. United Nations, UN organization, in its social and economic forum, it has published the Sustainable Development Health Goals, Sri Sathya Sai Primary, Secondary, Tertiary Healthcare. And it's also, as mentioned, that Sri Sathya Sai Central Trust has given free 400 US dollars worth of healthcare to the humanity free of charge. Towards this, if the healthcare which has a global recognition, let us see what our panelists will dwell on the challenges to sustain and expand. So now I'll ask Dr. Reeta to what are the key challenges in your day-to-day work in your department?
Day-to-day work has become a lot more challenging. The anatomies that we see are a lot more complex. If you just take off coronary artery disease, there's so much more calcium, so much more left main disease, so much more bifurcation, CTOs, and even young people are coming with it more and more. I guess it's because of the lifestyle and other things. But for us to deal with this on a day-to-day basis, we have to have an integration of the latest technology, the best equipment, and dedicated teamwork. And we have great teams at both the hospitals. So by Swami's grace, it is just Bhagwan's grace that, the Sri Sathya Sai Central Trust has always supported us in all our endeavors to handle complex cases. As Dr. Anil Mulpur was saying this morning, that whatever it is, it'll happen here. So there are challenges, but then there are solutions by Swami's grace, especially collaborative effort. It has helped us a lot. For example, when heart failure devices, they cost 6 to 8 lakhs each, the CRTD devices, ICDs. By Swami's grace, from the early 2000s, with collaborative effort of Dr. Raman, Dr. Garg, who've been coming here from then on, we were able to provide all this to the really needy. They cannot afford it elsewhere. So I think it's collaborative effort, having the best equipment, the support of all our seniors, teachers, and all our management, which has really brought us here.
Yeah, it's heartwarming to know the eminent doctors from USA and UK, and other organization corporations, they come forward to give their might to improve the patient care and then serve more number of patients in your department. I know you have already, your department has seen 80,000 patients so far. 80,000 procedures have been done in your cath lab, and 10 lakh patients have attended your cardiology OPD, and every day you see about 100 patients in OPD. You do about 8 to 10 cath labs. Very good. Now, I'll ask Dr. Varsha, is a professor of cardiac surgery, and she has got 4 decades of experience in cardiac surgery. She has performed more than 40,000 cardiac operations. And in the morning, incidentally, our honorable trustee, Mr. Naganandji, has also mentioned your name. You may not be knowing you are one of the panelists. I reminded him later. Now, how can we further strengthen and expand Sri Sathya Sai Ideal Healthcare? Please tell us.
I'm very grateful to be invited here. I am representing Shri Manoj Bhimani, our managing trustee. We have 2 hospitals, one in Rajkot and one in Ahmedabad. And both the hospitals, we are functioning with our chief trustee is Shri Bhagwan Sathya Sai Baba. He is managing everything, inflow of patients, outflow of patients, pre-operative care, intraoperative care, and post-operative care. We have seen miracles in this hospital, which I am actually attached as a consulting surgeon to 8 hospitals in Ahmedabad, but nowhere I have seen such miracles as I have seen in this hospital. So we can improve and strengthen and expand the reach of Sathya Sai Healthcare. First of all, we are totally free. Abdul Kalam has labeled our hospitals as Dil without bill. The last visit that he did in our hospitals, he mentioned these hospitals are deal without bill. And now we are totally free treatment, free consultation. Everything is totally free, including the relatives who are also being given lunch and dinner and everything. We have MOU with 8 states in the country. The government of Odisha, government of Rajasthan, the government of Madhya Pradesh, Bihar, Jharkhand, Assam, Haryana, and now we are working with Leh Ladakh and Chandigarh. We are connected with 8 states. And we have camps, regular camps in all those 8 states. uh, during the camp, one relative is also given food, breakfast and lunch, and treated, and they are given the to and fro fare also. They are brought by the buses by our Seva Dal, and the patients are being treated and examined and then given dates for surgery. Our last camp was done in Indore, and we saw 400 patients, out of which 150 patients were given date for surgery. This includes pediatric patient and adult patient. Our last pediatric patient was 2.5 kg.
Thank. Thank you for giving cost-effective and innovative approaches to expand Sri Sathya healthcare. We also have the telemedicine where 19,000 neuro patients, 19,000 cardiac patients have been benefited, and Sri Sathya Institute of Medical Sciences Whitefield. And we also have a nursing care, nursing college to have the qualified, compassionate workforce. We also have DNB program to train the next generation of doctors. And the DNB is a national examination in specialties and super specialties. And for the information of the audience, Sri Sathya Sai Institute of Higher Medical Sciences in Whitefield has got 9 gold medals, 3 in cardiac surgery and 5 in cardiology, 1 in neurosurgery. Is a big number for any single institution to have such a vast number of gold medals. With this, we will close down the panel discussion. The time is up. Already they have told me that time is over. And then to wrap up, the Sathya Sai ideal healthcare has to be given to the poor and needy. That's what Swami has been telling in discourses. And it has to be given in the atmosphere of love and care. And we have to recognize the fundamental right. To be healthy is the fundamental right of any human, Arogyam Moolamuttamam. And we should have more and more call for action. We should have more and more conferences like this. All the staff and doctors should join repeatedly, periodically. They should also share their expenses and discuss these things to have the proper deep understanding of Sri Sathya Sai healthcare, and also have the practical application of Sai principles in Sri Sathya Sai healthcare. In ancient India, we have the 2 texts, that is Sushruta Samhita for surgery, and the Dhanvantari, that is the Samhita, Charaka Samhita. These are the 2 ancient texts or treatises to guide the surgery and medicine in ancient India. Still people refer to these texts. But in the contemporary medical world, I must say, Sri Sathya Sai Samhita, Sri Sathya Sai treatise is going to guide the contemporary medical world for giving an ideal healthcare. Thank you very much, and thank you, panelists. Jai Sai Ram.
Our heartfelt gratitude to all the panelists and the moderator, Dr. Chalam, for a vibrant and thought-provoking discussion. Time is ruthless, and we are racing against time. We are lagging behind 2 talks, but since it's lunchtime, we will break for lunch. This brings us to the close of the morning session. The other 2 talks, we will have it in the post-lunch session. Before we disperse, a few quick housekeeping reminders. As the lunch venue and the conference venue are at different locations, mini buses and buggies have been arranged to for your convenience. If you're comfortable, we encourage you to enjoy a brisk walk to the dining area. Our volunteers are there along the way to guide you.